And welcome to Ask Your Academic. Today's session will cover the MSc Health Services Management, and we're joined by Sue Campbell, who will hopefully be able to answer any questions you have about the programme. If you've got any questions about sort of funding, accommodation, things like that, I'll post some helpful links into the chat box, and you should hopefully be able to find your answer there. If you don't, we've got an online postgraduate event coming up on the 7th of May, so that would be a good place to attend because there'll be sessions on those sort of things. We are recording today's session, so don't panic if you miss anything. We'll share it with you in the next few days that you can then rewatch it. And then if after the webinar, if you've got any other questions, you're not alone. We've got our administration email addresses on our programme web pages. Administration teams are brilliant, so if you do have any questions, just ping them an email and they'll do their best to get back to you with all the answers. So Sue, would you like to introduce yourself and tell us a bit about the programme that you run?
Hi there, welcome. Thanks for joining us, and thanks to those who will listen to the recording afterwards. So my name is Sue Campbell, and I am the programme lead for the Health Service Management Masters programme. So that means that I'm responsible for all the kind of teaching content and so forth. So I don't do all the teaching, but I put together the programme. So our Health Service Management on-campus programme has been running for a number of years now. Must be about 5 or 6 years that we've had all together. So various groups of students have gone through the programme. So as you probably know, a master's is 1 year full time, sort of September to September really. We have a range of professionals that undertake this programme. We've had doctors, nurses, physiotherapists, other clinical specialities. We also have people who have done maybe their undergraduate in business administration or have found themselves working in a hospital or healthcare management environment and have wanted to go on and learn more about the sort of management and leadership aspects of this, even sort of hospital sort of secretaries and things like that have completed the health service management. It's a very broad programme. There are a number of what we call core modules. So these are the modules that you have to take, which makes up 60 credits. Then there are what we call optional modules. So you can choose 3 20-credit optional modules from a list, which is most of them are on the website. So you can sort of tailor the programme a little bit towards your own kind of interest or expertise. You might be interested in health policy. You might be interested in global health challenges. You might want to keep a tight focus on sort of health service management and clinical leadership and that type of thing. So you've got a range of options there. So another 60 credits of optional modules. And then the final 60 credits is your project or dissertation, which if you meet the right standard in the top, what we call the top modules, the 120 credit top modules, you can progress to the dissertation. And if you complete that, then that gives you your master's. I mean, I guess in terms of the kind of jobs people do afterwards, what does that open, what doors does that open? A little bit does also depend on what your undergraduate degree is. So for example, you can't suddenly become a clinical medical specialist if you haven't already qualified as a doctor just because you've got your health service management. But we find that people work in hospitals, as you would expect. We have a number of students that come from a pharmacy background, and they might take a more senior role in the sort of pharmaceutical chain, if you like, or even working in research organisations. Students have gone on to work in sort of policy think tanks, so even working for sort of royal colleges in the UK, developing the kind of policy aspect, because as you know, healthcare is a very changing landscape. And I suppose that's important to point out as part of this programme, that you can't learn everything about health service management or leadership, but you should develop as a critical thinker so that when you're faced new challenges, you're able to come up with a plan of how you might be able to manage it. I mean, we've all seen the COVID pandemic and the pressure that put health services under, and we didn't all have let's say, an approach that would, we could pull out a toolkit that we could pull out that would, help us deal with that. But we had to be able to be critical thinkers and be able to be adaptable and use transferable skills, etc., to be able to manage that. So hopefully that gives you a little bit of an overview of the programme. If you have any specific questions, or Naomi, if you have further questions.
Yeah, so we've got a number of questions that were submitted beforehand, so our chat box might be a bit quiet, but I will keep an eye on that if we've got any other ones. So somebody asked, whereabouts are the classes typically held? Are they on main campus?
Yes, so
Yeah.
they're in what we call Gilma Hill, so the main campus, so in the old part of the university. So all our sort of on-campus teaching takes place there, which is a great space. We've got lots of places where you can sit and study, things like the James McEwan building, for example. So yeah, all on the main campus, so that kind of west end of Glasgow.
Perfect. Yeah, we've got lots of nice new buildings as well, don't we? So there's lots of nice spaces to discover. And I know there's no such thing as a typical week as an MSc student, but how often should students expect to be on campus in classes?
So we would expect, got to add up in my head now. So you're regarded as a full-time student, but on a master's programme, there's quite a lot of what we call notional learning or self-directed learning. So you might find that you have 6-8 hours of teaching a week, but there'll be a lot of further reading and sort of developing your learning. Yeah, so there's a lot of time where you can use the sort of study spaces or meet with your other students on the programme and work through things. So probably about 8 hours a week, roughly, actual fixed contact time.
And I'm assuming that'll become more apparent when registration opens and you start getting your core classes and building your timetable up.
Yeah.
With the optional courses, when do students choose them? Do they choose them as they're registering, or is there a bit of time where they get more information to then pick their courses?
We encourage students to kind of choose their optional courses after about 2 weeks of the programme. So when we start in September, towards the end of September, that's partly just to make sure your first choice doesn't get full or anything like that. So you kind of get your foot in the door. On saying all that, if you decide that, if you in the introduction modules, you've learned a little bit more about management and that's the kind of route you want to take, or you've done a bit on policy and that's the route you want to take. Usually at the end of by the end of that first semester, so just, before we break in December, then you can change, providing that there's space in the option you want to change to, providing that there is space. So it's not a huge pressure. And I appreciate it is difficult trying to choose what modules you would like to study, because there's interesting bits on all of them. Yeah.
At least there's that bit of flex there.
Mm-hmm.
And what about the lesson material? Do students get access to that before classes, that they can sort of have a wee look over it before they go to class?
Yeah, so we use a platform called Moodle where we upload the course materials. Now, usually, so if you had a lesson on Wednesday on something, usually you'd find at least, before that previous weekend, there would be some slides and some content. And sometimes teaching staff would ask you to review a video or read a paper prior to class, so that we sort of encourage a lot more discussion. So, it's not all didactic teaching that we just, give you information and you sit there. We do encourage a lot more participation in classes. Yeah.
Right. And what about assessments and exams? How do those work? Are they quite mixed and varied?
I think one of the difference that students say when they're coming from, for example, non-UK countries, is that we have very, very few exams. So each module will have its own assessment. Most of them will have perhaps 2 assessments. It might be that you have to develop a poster on something and write a report on something. And most of it is written, either reports, essays, presentation, or deliver a presentation. I mean, I would say currently there are absolutely no exams in the programme, so it's all this assessment format, which I know is quite a big change for a lot of students. And then there's no overall exam or assessment at the end of the programme. You pass each module, and then or you do the assessment for each module. And then, you have your overall dissertation, which pulls together quite a lot of key themes and concepts, if you like.
Okay, it's probably worth mentioning as well, actually, all the courses are linked on the webpage, and I think there's a wee bit of information there about assessments and things, so you can get a bit more information on individual courses. You mentioned the research project is quite a big part of an MSc. Can you tell us more about that, how you go about choosing your topic, your supervisor, when it starts?
So all students will, as part of the core modules, will have to do a research module, and that's to give you some skills in undertaking research. When it comes to doing the dissertation or the project, generally students don't need to start actually working on it till around sort of April, May, but there are, in the preceding months and weeks and months, then students can start thinking about their topic. So on the Health Service Management programme, students choose their own topic. They're not given a topic, and students will be allocated a supervisor based on what sort of area of interest that they have. So you don't need to find your own supervisor. You don't have to develop original research, so you don't have to carry out interviews and things like that, or gather your own data. You can do a literature review, so a sort of desktop study, which if you're new to research, it is quite a sensible approach in a lot of ways, in order to let you sort of build up the confidence in sort of following proper procedures. Yeah, when we encourage students to sort of start thinking about topics and doing some basic sort of search from the library websites, but you don't need to do anything in advance of arriving on the programme. All the information will be given to you once you start.
Perfect. And I suppose that's quite nice that as you do your different courses, you maybe see where your interests lie, and then that could help develop your topic.
Yeah,
Um,
definitely.
and in terms of preparing for an MSc, it's so much different for from undergraduate, and especially if you've been out of studying for a while. Have you got any sort of advice on how to prepare for starting the MSc?
I think I mean, one bit of advice would be, I can send on links even to some of the sort of think tanks in the UK to kind of understand the kind of current context of health service management. In other ways, I think, we're doing, I think one of the important things is to make sure you arrive for the programme on time, because we do sort of an induction week. So before the actual core teaching starts. And I think that's important to get yourself orientated to the university, get yourself settled. And we do offer a number of sort of online programs on things like critical thinking, and sort of improving your writing from sort of the undergraduate kind of slightly more descriptive approach to the more critical thinking of a master's student. And that's very much what we're looking for. So in some ways I would say don't panic, but make sure you come ready, you're organized and ready to start on time. And you can sort of relax, and maybe relax is not quite the right word, but you can get yourself settled before you start.
Perfect. Well, that's covered off all the questions that we had submitted beforehand. We had a question in the chat box there about funding, so I've provided a couple of links, and I've put some links in the chat box as well there, so hopefully that helps. And like I say, that upcoming online event would be a good place to get more sort of specific advice on your sort of funding and things like that. I don't know, Sue, is there anything that you feel we've not covered that you think would be good to mention? any highlights of the programme that you know that students enjoy? I always hear that they really enjoy their research projects because it's quite freeing, like they can really sort of choose what they're doing and sort of learn a lot more.
Yeah, I mean, I think definitely the research project. I think it allows a lot of that learning to kind of come together. It sort of falls into place as you're working through something practical. Uh, I think the students also sort of are interested in the fact that they do courses from the Adam Smith Business School as well. So it's not just from the medical and veterinary and life sciences school, but they have and through that they meet students on other kind of professional pathways, if you like. And there's different kind of awards that people work towards as well. There's a sort of Adam Smith has its own kind of awards, and we also have our sort of graduate skills training awards as well. So I think one of the things that, is to come with, when you come and start a program, you want to try and get the most out of it. It's not all about the studies, but we've got loads of clubs and societies, and you can do, get involved in volunteering and things like that to try and sort of give you a different perspective. And I think for those even from outside of the UK, that can also help with improving language and being able to speak and converse um and that type of thing as well. So yeah, I mean, I think there's always lots going on, not enough hours in the day. Yeah, it's a nice friendly campus actually. Yeah.
Yeah, it always amazes me the amount of clubs, societies, different things you can get involved with. And you're right, it's if only there was an extra few hours in the day. It's just managing that sort of balance, isn't it, of the
Yeah.
studying, but then the fun side of things, because you are here for a short period of time, so you want to really make the most of it.
Yeah.
Um, well, yeah, I think you've covered a lot of information there in a very short space of time. So I think it's probably a nice place to wrap up. Like I said, if after this you think of any other questions, please do get in touch with us with that administration email inbox, and the administration teams will get back to you. But for now, I think that's thank you and goodbye, and hopefully we'll welcome you all in September. So thank you. Bye bye.
Take care. Thanks. Bye bye.